And next, we're going to hear from Melanie Begian. She's a experienced clinical pharmacist who works in our home infusion department. She has greater than 15 years of experience in educating and providing care for our Kaiser patients with chronic illnesses such as malnutrition, cancer, bacterial, viral, and fungal infection, and many, many more. Her clinical experience is a unique merger of her pharmaceutical education background and daily hands-on experiences in helping our patients who are suffering from their chronic illnesses. Just yesterday, one of my patients, Donald, I hope you're watching, Donald. He would like me to praise Melanie's involvement in his home infusion treatment. He said the care he received under Melanie's direction is world-class, and Melanie is one of the most motivated and mindful person that I know. And now I hand over the presentation to Melanie.
Dr. Sue, thank you so much for that incredible introduction. I'm humbled. I am glad to be here of service. Hi, everyone. Good morning. Thank you so much for joining us today for this talk. My name is Melanie, and I'll be giving you a presentation on wellness, nutrition, and mindfulness. A little bit about me. The reason why I wanted to give the presentation today is partly personal and partly professional. In my own daily life, I have been practicing nutrition and mindfulness for over 10 years, and it has helped me immensely. It helped me get off a bunch of medications for allergy, asthma, and acid reflux disease. So naturally, I try to spread the gospel to my patients. My experience for the past 15 years, just like Dr. Sue said, has been in taking care of chronically ill patients, and it's been my passion to try and help them change their lifestyle and diet. Some politely listen, some are curious and enthusiastic, but unfortunately, most don't really want to do much to change their lifestyle and diet. It's always easier to pop a pill than change your lifestyle and habits. Today, we'll talk a little bit about wellness, nutrition, and mindfulness and how it affects the physical health of a person in cancer treatment. Let's quickly go over the major cancer treatments. One is surgery, radiation, chemotherapy, immunotherapy, and targeted therapy, which is our focus for today. Taking care of yourself while going through treatment is very important. Hence the talk about diet, exercise, meditation, which includes stress reduction, holistic approach, such as acupuncture, supplements. Diet. My personal motto is food can heal or food can harm. A direct quote from Dr. Oz, foods are drugs not regulated by FDA. Our bodies see them as drugs, very subtle in their action. Our bodies are designed to respond to certain stimulus of food. Well, I couldn't agree with him more. All right, a little bit more about diet. Eating the same type of or amount of food before your diagnosis of cancer may need to change to get you on a healthier path of eating and make it a part of your lifestyle. Also, sometimes side effects from your treatment may affect your taste or you may have a harder time digesting your food. Sometimes cancer in and of itself may cause swallowing difficulties or tumors that can cause diarrhea, nausea, vomiting, so on and so forth. Pain can discourage you from eating or taking away the enjoyment of you eating food. Malnutrition and weight loss could be a problem in patients getting treatment, but weight gain could also be a problem. We'll talk a little bit more about this later. So how do you get food necessary in your body to improve your response to treatment and healing? Well, the food pyramid gives you a guideline. Eat more fruits, vegetables, beans, whole grain, Decrease your take in red meats, fats, sugar, and salt. Liquid meal replacements, such as Ensure and Boost, they are considered in patients, they should be considered in patients that can't meet the protein requirements, but it should only be in conjunction with regular meals and not replace your daily healthy diet, since they are considered processed and contain lots of sugar. So how can we treat this? Well, you can do decreased sugar carb intake, or actually, let me just go back a little bit and talk about what's in our GI tract. So the bugs in the gut, what's in your GI tract? Your GI tract is the residence to trillions of microorganisms, including bacteria, fungi, and viruses. Our gut has thousands of bacteria species. 70% of your immune system comes from your gut, and about 90% of serotonin is produced there. Studies have shown persistent imbalance of gut bacteria, also known as dysbiosis, may be related to irritable bowel syndrome, inflammatory bowel disease, diabetes, obesity, cancer, cardiovascular disease, and nervous system disorders, just to name a few. What causes dysbiosis? Well, medications such as antibiotics, which can kill not only the bad bacteria, but also the good bacteria, steroids, some over-the-counter medications, and oral contraceptives, just to name a few. Bad diet. Stress also can definitely cause intestinal dysbiosis. How can we treat this? Well, decrease sugar and carb intake, increase your fiber intake, stress relief, slow breathing. Go for a walk, get out in the sun, get a massage, stretch. Improve your sleep quality, meditation, avoid alcohol or caffeine before bedtime. Stick to a sleep schedule. Make your bedroom a restful environment. Get rid of all the devices that you have there. Data from NIH and UPMC shows that gut microbiome can alter treatment efficacy in response to immunotherapy. Now that we know healthy gut plays a big role in our immunity, what can we do to optimize our immune response? Diversity of your gut microbiome comes from eating a variety of fruits and vegetables rich in colors: greens, reds, oranges, yellow, white, purple, etc. These types of food contain phytonutrients. Well, what are phytonutrients? Also known as phytochemicals, phytonutrients can provide significant benefits to us. They have antioxidant and anti-inflammatory properties. They may enhance immunity and intercellular communication, repair DNA damage from toxin exposure, and detoxify cancer-causing agents. Many phytonutrients give plants their pigments, so a good way to tell if a fruit or vegetable is rich in phytonutrients can be its color. Now that we know this, not only the key is to eat a rainbow of fruits and vegetables, it's also important to eat a diet rich in fiber, whole grains, seeds, legumes, olive oil, avocado, fish, nuts, and other food items such as these. Another great way to increase the diversity of the gut bacteria is to look into fermented foods, such as pickles, kombucha. I have it right down here. Kombucha, kimchi, sauerkraut, kefir. Well, that's if you're not lactose intolerant, and many others. Foods to avoid. Wow, look at this. I love this types of food, but processed foods, really bad for you. My rule of thumb is anything you can't read the name on the food label or the ingredients section, don't eat it or buy it. Sugary drinks, alcohol, refined wheat, most fruit juices, fried foods, food with preservatives, shortening, junk food, anything made with sugar, such as candy, cookies, cakes, pastries, just to name a few. All right, exercise. Often patients are too tired to exercise, and sometimes they are on steroids, so it makes them eat more. This can contribute to muscle wasting and gaining weight, which can create a vicious cycle. You're too tired to exercise, but you're eating for comfort. You gain weight, so you get more depressed and lack motivation to exercise. Less exercise, more muscle wasting, and the cycle repeats itself. Treatment process is improved with exercise programs. Numerous studies have shown the importance of exercise on morbidity and mortality. It may help prevent recurrence of cancer or other cancers. It's beneficial on combating some of the treatment side effects such as fatigue, improved mood, such as anxiety and depression. Also, it helps improve sleep. Just remember, it's never too late to exercise. You can always start an appropriate exercise for your weight, age, and fitness level. Meditation, my favorite part. During treatment, you will be facing some of your greatest life challenges. Meditation offers us to be fully present in every moment, present without any judgment or resistance, regardless of what is happening to you physically, mentally, emotionally, and spiritually. Meditation helps us to be peaceful and calm and better able to find meaning in life. It's to accept your body just as it is and feel better about your life. It's okay to have scars. It's what makes you you. It's to treat ourselves with compassion and care. Meditation also has shown to lower the levels of cortisol and increase immune function. People that regularly meditate have lower levels of cortisol in their blood because they're reducing stress. Also, they have higher immune function than other people that don't meditate. Meditation also reduces certain factors that may cause cancer and promote healing. Holistic approach, acupuncture. Acupuncture is one example of holistic treatment, which also includes cupping, manipulation, diet, exercise, and herbs. The ancient practice of acupuncture started in China approximately 3,000 years ago. People, they were doing this stuff 3,000 years ago. Acupuncture is used to treat disease or relieve pain. It's known to stimulate the release of endogenous opioids, such as your endorphins, which makes you happy. There is a lot of information online for you to research. I'm not going to go on anymore about this. As you know, you can research this on your own. Acupressure. Acupressure is an alternative medicine technique often used in conjunction with acupuncture. It is based on the concept of live energy, which flows through your meridians in the body. Aromatherapy. Aromatherapy uses natural plant extracts to promote health and well-being. Aromatherapy uses essential oils to improve the health of the body, mind, and the spirit. It enhances both physical and emotional health. Ayurvedic medicine, also known as Ayurveda, is one of the world's oldest holistic whole body healing systems. It was developed more than, again, 3,000 years ago, this time in India. It's based on the belief that health and wellness depend on a balance between the mind, body, and the spirit. Herbs and supplements. Well, that's a bit tricky. Since you're going through treatment, I would suggest for you to speak to your oncologist if you're going to take any herbals or homeopathic supplements. It's important to have a good relationship with your oncologist and have an open and honest discussion with them regarding your desire to take herbals during your treatment. Well, we're at the end of my presentation. Thank you for listening to me. If you have any questions, please feel free to ask. Thank you for your time. Have a good night.